In the name of God, most gracious, most merciful, we would like to welcome the speakers to this press conference of the National Medical Task Force for Combating Coronavirus COVID-19, His Excellency Dr. Walid Al-Mana, Under Secretary of the Ministry of Health, Colonel Hamad Al-Khayyat, Director of Operations at the Public Security Presidency, Lieutenant Colonel Dr. Manav AlKhattani, Infectious Disease Consultant at the BDF Hospital, and Dr. Jamila Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to note that this press conference is going live on TV and on the YouTube channel on YouTube in 5 different languages, and we also have the journalists and reporters joining us remotely. As usual, we begin with Dr. Walid Al-Mana, Under Secretary of the Ministry of Health. In the name of God, most gracious, most merciful, praise be to the Lord who has held everything within His knowledge. Praise be to Him for His countless blessings and grace. And praise be to the Prophet. I'd like to welcome you again to this press conference in order to update you on the most recent information regarding dealing with COVID-19, and we, as usual, update you on the recent updates. Well, we have 4 points. First, the updates on the national efforts and the contribution of citizens, and then we're going to review the actions taken against violators and the efforts to track the false allegations. Third, we're going to continue correcting the misinformation and false information that were identified recently. And fourth, we're going to review the treatment protocol of the active contact and some of the messages to citizens and residents. Well, within the national efforts to limit the active cases, the capacity for vaccination was increased to 31,000 vaccinations over 31 centers, and therefore the waiting time was reduced and from 1 day to 5 days maximum. And all the information about the vaccinations are available on Be Aware app or the website of the Ministry of Health, healthalert.gov.bh. And we have the capacity for vaccination for 31,000 per day. And due to the non-compliance of some people, the daily average was 26,000 only. So that's why we call upon everyone to commit to their appointments. Now, 90% of the registered were vaccinated, and 26% of them took their vaccinations on their appointments. And we note that non-compliance to appointments for vaccination, which are sent through text messages which have the time and date, would cause traffic. That's why we call upon everyone to comply fully to their appointments in order to accelerate the vaccination process and avoid any delay. And within the national efforts, the capacity for treatment centers for medium and critical levels in order to deal fully with the active cases. There is a building which was launched and established at Salmania Medical Complex, and a number of treatment centers were prepared in order to increase the capacity for treatment. And that's why we count on you to take the initiative to take the vaccines in order to protect you from the medium and severe symptoms which might lead to ICU, God forbids, or to death. And as for the national efforts for the call center 444 since February up to the number of the calls up to May 2020 received 4,800,000 calls and around 700,000 calls in May, and 32% of them were regarding inquiries about vaccination, and 10% for reporting difficulties in accessing Be Aware app, and 7% for other inquiries. So around 49% as a total for receiving calls for regular services which can be accessed through Be Aware app. And out of the statistics, out of 163,000 calls received about the symptoms of the virus, out of these there were around 102,500 calls, representing 63% of these calls that did not match the options selected for the service. And this, of course, affects and have an impact on the calls. This is really important because when you report symptoms has really a priority. But if you are using this option for something else, as we said, around 63%, they do not really go with the reporting symptoms. This will affect the service. So your role is in reducing the pressure on 444 so we can have the calls only for the emergency and critical cases. So please choose the right option when you call 444. And for normal and regular services, you can use Be Aware app or the website of the Ministry of Health, healthalert.gov.bh. And we would like to note that the new option has been activated on healthalert.gov.bh for any general inquiries. So you can access to this website and write all your inquiries, and we will get back to you as soon as possible. And to conclude, for the national efforts to follow up on the implementation of the decisions, since 27th of May, 1,003 visits were conducted for restaurants and cafes, and there were 153 violations reported, and 12 restaurants and cafes were closed. And we note that your community awareness as citizens and residents will contribute to the reduction of these violations by implementing all the decisions. Again, your community awareness will contribute to the reduction of these violations by complying with these decisions and precautionary measures. And at the same time, we call upon the owners of these establishments to comply with them. And we are all responsible for the health and safety of everyone in our beloved country. Now, I call upon everyone to continue implementing all the precautionary measures and all the decisions issued in this regard in order to achieve our ultimate goals by dealing with this virus. Now I leave the floor to Colonel Hamad Al-Khattani, Director of Operations at the Public Security Presidency in the Ministry of Interior, who's going to talk about the charges taken against those who did not comply with the decisions. Please, the floor is yours. Thank you very much, Dr. Walid. In the name of God, most gracious, most merciful, I welcome you, and I emphasize that the current situation requires the collaboration of everyone because it is a national duty, and we count on the community awareness. And in implementing the decisions of the Minister of Interior to take all the actions necessary to safeguard the safety and health of everyone, the relevant authorities are following up on implementing all the guidelines. And we will review with you some of the statistics in this regard. Well, 9,570 actions were taken on social distancing, including beaches and public places, and around 82,994 legal actions and procedures were taken as violations for non-wearing the face masks in public places and shops. And also the coordination is continuous with the Ministry of Islamic Affairs and Waqf for the mosques in order to implement the guidelines. And also the Ministry of Interior is providing all the necessary coordination with the Ministry of Commerce to ensure that the closure of those shops violating are taking place. And we confirm that the Ministry of Interior is taking all the actions, whether from against people, individuals, or establishments. And let's review also the efforts of the civil defense. They have conducted around 314,533 disinfection processes for establishments, governments, roads, and around 2,209 were taking part in this disinfection. Also, 1,230 individuals were trained to disinfect the mosques. As for the ambulances, the capacity was increased, and there was a mechanism established and developed for the national ambulance, which as a result reduced the waiting time to 18 minutes and also 12 minutes of leaving the ambulance leaving the center. And recently the ambulance service received thousands of calls, and they have specialized team to deal with this. We have around 400 ambulance visits per day, and also we have buses equipped that has conducted around 36,000 visits, and they picked up around 100,000 individuals who do not experience any symptoms. This shows the competency of the services. And as for the electronic services and expanding them, the Ministry of Interior is transforming most of the services for citizens and residents without their actual and physical presence. And in case they have any need to have their physical presence, they are referred to scheduling appointments and limiting the services for the Ministry of Interior according to the guidelines of them for only those who took the vaccines after taking the 14 days or the recovered ones. And they have to be above 18 years old. And we note that the disaster committee is doing their best, represented by the concerned ministries, are doing their best to maintain the safety, and those violating the quarantine and self-isolation were referred to public prosecution. We have around 3,591 individuals referred to public prosecution, and we note that this violation could lead to prison 3 months or penalty of 1,000 dinars and not exceeding 10,000 dinars. Also, the criminal investigation for electronic services were taking any violations, and we call upon all citizens not to spread any misinformation, especially which could have negative impact on society. And we call upon everyone to take the accurate information from the right sources, and by implementing the regulations is a national duty which requires everyone to implement this, especially like it's about the health and safety of everyone. Now, I'll leave the floor to Lieutenant Colonel Dr. Manav AlKhattani, Infectious Disease Consultant at the BDF Hospital. Thank you very much, Colonel Hamad Al-Khayyat. In the name of God, most gracious, most merciful. Good afternoon, everyone. As Team Bahrain is occupied on combating their coronavirus, the media team is tracing all updates on media and social media, and we have 7 questions that we identified, and we would like to share with you their answers. Number 1, what are the reasons behind the increase of the active cases in ICU, which are over 300 cases? We have calculation. The more you have the active cases spread among society, with the non-compliance with the guidelines would lead to an increase in active cases. And the more you have active cases, especially in weak immunity, like the elderly or those with chronic diseases, this would lead them to be admitted to ICU, and their situation could go worse. And this is internationally happening. And so this would lead to ICU, and therefore that's why you have the more death rates. But if we go back to statistics, we go like 1st of June, the active cases in ICU, only 326 cases. Among them, 270 cases for those who did not take the vaccine. So around 83% of those active cases in ICU for those who did not take the vaccine. And if they took the vaccine, it would be less that they don't need to go to the ICU. Also, the increase in the death cases does not mean like there is lack of services. The Kingdom of Bahrain is recognized globally, before locally, that we're providing the best treatment protocols, and we are in line or taking the initiative to provide the best medical services for citizens and residents alike. And the increase in the number of the recovered, like thousands of recovered going out of the quarantine or self-isolation, this shows that the treatment protocol is really approved and it's providing the best services. Question number 2, why the floor was open for the Kingdom of Bahrain to be quarantined for citizens and those coming from abroad, and then they can go and take Bahrain as a transit, as a quarantine to have a transit. Well, up to now, we have listed 7 countries, and we are updating the list on a daily basis as part of the red list. This red list shows like those countries are the most exposed to active cases. India, Sri Lanka, Bangladesh, Vietnam, Nepal, Pakistan, those were listed in the red list, and we have strict precautionary measures for those arrivals from these countries to the Kingdom of Bahrain, even if they have an active visa to the kingdom, just to avoid any variants. As for passengers, whether recovered or as for vaccinated or not, from outside this red list, we still implement the quarantine for 10 days at their houses or for specific places, not to mention like we require a PCR negative before going onto the plane, and we also test them upon their arrival. And this is really strict, that protects having any number of cases back to the country. In addition, these daily statistics in Bahrain that we usually spread, even those active cases from outside Bahrain from 1st June is less than 0.0, so it's less than 1% of the active cases. So the third question, we see some people like posting on social media, especially those who have a large number of followers. Unfortunately, they show their gatherings in private places or majlises regardless of the precautionary measures. So what are the procedures taken against them? So what is the message to those people? What my thing is like, what do they want to show to people by not complying with these precautionary measures? And I think Colonel Hamad Al-Khayyat showed how much of those violations, which are like an obstacle to the national efforts, because they could do and make use of their efforts in something useful. But I note that any individual, whether citizens or resident, you have a responsibility, a national responsibility and a personal one that you have to take. And you should not be a reason for spreading the active case, the virus through the gatherings. You could lead to the spread of this virus among those weak immunity individuals, and you don't want to be a reason for this, and it could be one of your relatives. Question number 4, do we need to reconsider the approved vaccinations because we have an increase in the active cases in line with the increase of the vaccinated people? And I think we have mentioned this thousands of times. The vaccination should come with complying with the measures, and this is the only way to get out of this pandemic. And I don't see any reason to say that the vaccination, so we should agree that all the vaccines approved in the Kingdom of Bahrain by statistics proved that they are the reason to protect people from the complications. And I still repeat that the vaccination would increase the immunity, but it would not stop the infection. As you say, the infection rate among those vaccinated, if they do not comply while vaccinated, this could lead to their infection. Question number 5, what are the symptoms and cases that require going to hospital and which ones that would require home self-isolation? I think I'll leave this to Dr. Jamila Salman, but we always say that there are symptoms that really require you to call the hospitals. And there are cases, and I think it would be mentioned by Dr. Jamila Salman, that do not need you to take from the efforts and times of our team, because this will really hinder the efforts, and this could cause the delay of ambulance to other cases would really need this. So question number 5, 6, how do you guarantee as a medical team that the home self-isolation, especially following the violations of this isolation in the past 2 months? Well, there is nothing better than the self-assessment. You have to realize this. You should not accept it individually, but regardless of that, we are following them. There are few people who are violating the measures, but by implementing Be Aware app, we are tracing their movement and violating them according to the law applicable. And the last question, has vaccination proved its efficiency for kids, and what is its impact on the reduction of the virus? I'm really glad to see the guardians registering their children to take the vaccine, regardless of the false allegations from few people who don't realize the efficiency of this vaccination. We've seen the spread of the virus. There are kids who got infected. Are we waiting for these kids to be admitted into hospitals or ICU, or God forbid to lose their lives, just to say that the vaccination is efficient? We don't have anything more valuable than our kids, and that's why the vaccination is the only means, because kids are the main reason for spreading the virus. We've seen the statistics. So complications could go into this group, children. So that's why we allowed the vaccination for this. And me as a father, I ensure to tell all the parents, please take the initiative to have your kids vaccinated, because if it's too late, you will regret it. So what is our responsibility? We need to be patient and to be like a wall against those who would like to underestimate our efforts. Our statistics proved for the millions of times that the virus is among those who are not vaccinated. And I conclude, may God protect Bahrain and their people, and we get out of this safe. Now I'll leave the floor to Dr. Jamil Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. Thank you very much, Dr. Manav AlKhattani. In the name of God, most gracious, most merciful, welcome you all, and let's talk about the 4th point in this press conference, about 3 points. The updated protocols for contacts and active cases, and some statistics about death cases, and some of the important messages. Today, and after 1 week of implementing the decisions that we announced in the previous press conference, we have the following messages. This message is very important. There are positive indicators to correct the curve. For the past 3 days, we saw that the figures are going stable, and we need everyone to continue implementing these measures in order to achieve the goals, and hopefully we'll reduce the active cases. Second, we reiterate that everyone should implement all the precautionary measures that we announced previously for more than a year in order to protect the health and safety of everyone. Third, and this is really important, we repeated it many times, the importance of vaccination and its safety in order to reduce the active cases and to protect the society, and take the vaccine and register for it. Fourth point, we call upon everyone to take the initiative to take the booster dose for those who meet the requirements, because this would help increasing the immunity and antibodies within the body. Fifth, which is very, very important, and I think Dr. Manav pointed out that we noted recently there are some delay in reporting the symptoms. Some would go to the emergency after the delay of reporting the symptoms. So when we have the case in a later stage, it would be difficult to provide the best treatment. That's why we call upon all the elderly or those with chronic diseases, please take the initiative to report the symptoms in order to arrange for you to go to the treatment center and give you the best treatment. Well, the second point about the statistics for the death rates from January 2021 to May 2021, and the statistics is the best proof that the total death rates of active cases were 665 death cases. For those non-active, non-vaccinated were 90% of those death cases, while only 10% of those numbers are from those vaccinated. And this shows the efficacy of the vaccination. And out of these 90% of the death cases, we notice that 94% of this 10%, because they have chronic diseases. We know that the body would respond to the disease according to the immunity system within the body, and whether they are elderly or chronic diseases, so they will have a weak immunity system, and that's why we notice this in the figures. And we stress that non-compliance with the precautionary measures and not taking the vaccine or the booster dose would cause risk at the individual, their society as a whole. And according to the statistics, the vaccination will reduce the death rates and the infection, and even if you got the infection, you will reduce them to mild symptoms and reduce the death cases. And the third point, the updated treatment protocols for active cases and contacts. And let me review with you these updated protocols. Let's start with home self-isolation. First, a message will be sent, text message, to the individual without the need to go to the centers. And after receiving this, you will have to download Be Aware app. Upon the result of the PCR, and after you download the app, you will click Start Isolation, and it will be activated automatically for those active cases. And you will have to commit taking the photos upon request whenever needed. Out of these cases, a number of these active cases, like for example, mostly exposed to symptoms or ICU, they will be sent to the treatment centers to assess them. If they have any critical cases, if they have any critical symptoms, chronic diseases, or they are over 50 years old, they will be reported of the appointments by the Ministry of Health. As for activating the self-isolation for contacts will be as follows. They will have to download the Aware app upon the discovery of the contact. So anyone they found or they knew that they are contact of someone, they will download this app. The contacts will be limited by the team in charge of tracing the contacts in the Ministry of Health. After identifying them, and they will be contacted by the Directorate of the Public Health, and they will activate their status on Be Aware app, and then they will click Start Quarantine on the app, while ensuring to take the photos on an updated basis whenever required. In addition to what mentioned, well, there's a point about the PCR test for contacts. Those contacts who are over 50 years old will be registered, or if they have any symptoms, for a PCR test whenever they have any symptoms, and if they are negative, they will be arranged for a test after the 10th day. If they are 49 years old or less, they will only have to take the PCR test after the 10th day. Unless they had any symptoms, they report them and then they will have an appointment. 3 days before the end of the quarantine, they have to arrange for an appointment to get out of the quarantine through Be Aware app. In all cases, and this is really important, if you are a contact or if you have any symptoms related to COVID-19, please isolate yourself. You don't need to wait for the call from the tracing team, because they will call you, but it's important for you to speed up in isolating yourself and implementing all the precautionary measures at home, because anytime you contact someone else, you put them at the risk of getting the virus before activating the service. And the fourth point, yesterday, Kingdom of Bahrain announced the emergency use of a new medicine, and it is sotrovimab. This medicine is produced by GlaxoSmithKline after the approval of the U.S. Food and Drug Administration. This medicine is following the positive results of the clinical trials, and it's providing the best treatment for the active cases and from getting developed into mild or critical symptoms, but they have certain requirements. So it is based on monoclonal antibodies. So these antibodies will get into the body to create antibodies, and it gives treatment for those who are 12 years old or over. And if they have any symptoms for corona, but they are like mild or medium, and those who have underlying or chronic diseases, so they prevent this from death rates. And this contributes, according to the results, to reducing the death rates as a result of the complications by 85%, which is a very good result according to the studies up to today. So this is going to be very good, optimistic results as an early treatment from the early stage of the virus. And to remind you, please implement all the precautionary measures which we got used to because of their importance, like social distancing, washing hands, sanitizing hands, avoiding gatherings, family gatherings, and even within the same family household, even if we have those with chronic diseases, please implement these precautionary measures so we can avoid spreading the virus to them. To conclude, by the collaboration of everyone, we can get over this challenge, and we're going to prove this as before, and to get to the ultimate objective. Thank you very much. Thank you very much to the speakers for your briefs, and now we'll leave the floor for the questions from reporters who are joining us remotely. Question from GDN, from Raji to Dr. Walid Al-Mana. What is the reason and the objective of reducing the daily PCR tests over the past 3 days? Thank you for the question. The question, maybe it is not said in a right way. We did not reduce the PCR tests. Just to let you know, everyone, that the PCR tests we conducted previously, even before the increase, were like 13,000 to 15,000. They could be a bit less or more according to the cases. Some of the tests, they're not going to change. Whether like if they have like the end of quarantine, those in hospitals, the random tests, those ones we can't change. There was no intention, no objective. In fact, there was an increase in the conducting the PCR tests. Generally, and whenever we have an increase in active cases, we look at the person, if they have contacts, if they have like large contacts, they contacted 10 people, 20 people, 30 people. So by nature, we will have tracing and we will have, trace those contacts. And sometimes the increase of the PCR test because of tracing those contacts in a more professional, scientific manner. And so maybe over the past 3 days, people maybe noticed the less in PCR tests. We've got like maybe we got from 3,000 to 2,300. So even contacts will be less. That's why the PCR test will be less. So just to point out, there was no reason we did not reduce the PCR tests. In fact, we are tracing them as usual. Maybe just the increase of the decrease of the active case would be related to contacts out of the average that we have scientifically. Question from Al-Watan to Samahar Saif to Dr. Manav AlKhattani. When does the individual have to do the antibodies test? Well, first, the CDC announced recently that it is not advisable to conduct the antibodies test because some of the people got the sense that if they have the antibodies, then they can do whatever they want. And this is exactly what happened in our society in Bahrain. We said antibodies could not mean exactly like it gives you protection, fully protection. That's why there was the global recommendation. Those who took the vaccine should also implement the precautionary measures. Having the antibodies does not mean that you are 100% protected. Sometimes we have certain cases for those taking like medications that reduce the antibodies or the immunity. That's why we do the test for them. But the misuse of conducting this antibodies test could give the people the sense that they are protected, and that's why they don't implement them, and then could lead to the increase in the active cases, not only in Bahrain, but outside Bahrain. Tamam Busafi, Al-Ayyam newspaper to Dr. Jamil Al-Salman. The treatment protocol implemented in Bahrain has been really successful, that achieved 98% in recent months. But is the treatment feasible? Is this protocol still feasible with the new variants, or do we have a need to change them? Thank you for the question. It is really important for the treatment protocols in Bahrain. We are among the top countries who's developed those for COVID-19. And as mentioned by the question, it really proved its high success. Well, this is related, as mentioned, to the cases from the beginning of the from the beginning of the death, from the beginning of the case or till the end of the case. So sometimes some medications are used for mild or medium, like the new medicine announced yesterday by Bahrain and approved by Bahrain, and sometimes some medicines for mild, for critical cases. So we have proven the efficiency of the protocol. But what we noticed recently, some cases could come to the healthcare at a later stage, and this could not give the chance for the treatment or nursing team to provide them with the appropriate treatment. So we believe for infectious diseases, it's important to provide them with the treatment at the earliest possible. As for the changing the protocol, I don't want to call it change. We could call it updating them. So as you know, COVID-19 is novel, and the scientific studies are huge, and maybe daily or weekly there are new studies for new medicines. They try them on this virus to see if they have any positive impact or not. And we in Team Bahrain and the medical task force, we follow all of them and see what we can add to the protocol in order to reach the best results. A question from Bana to Colonel Hamad AlKhattani. Do you identify those spreading false or rumors, because this is really dangerous, and do you take legal actions against them? Yes. The Directorate for Fighting the Criminal Electronic Crimes identify those rumors, and they take accordingly the legal actions against those who are spreading the rumors, because they are hindering the efforts and they are causing panic to people. That's why we call everyone to take the right information from the right sources. Thank you. Question from Rashal Ibrahimi from Bana. Has the reduction of the test contributed to the reduction of the active cases, and does that support maintaining the health system? I think this is almost the previous question. Again, they indicate that we are reducing the the PCR test. We are not reducing the PCR test. We are doing this as usual, and sometimes because of the increase of the active cases, they have contacts. So we have reached 20,000 per day, but the average one, 13,000 to 15,000 on a daily basis, and we did not go lower than this. So how to use this proves the efficiency in identifying, tracing the. So I think the question is similar to the previous question, and I confirm that there is no reduction, and there is no objective we're reducing the tests in order to reduce. We have a clear methodology in a very transparent manner, but this tracing is according to what is necessary. Well, now we conclude the question and answer sections. Thank you very much, the speakers, for your briefs and answering the questions. We also thank the journalists and reporters who joined us remotely. Before concluding, kindly be reminded to follow all the precautionary measures and guidelines to mitigate the spread of COVID-19 and combat it. Thank you very much.